But first tonight, it's a controversial drug that President Trump and Kansas Congressman Roger Marshall say they're taking, even though they don't have coronavirus. Hydroxychloroquine. Now there are questions if it's effective or if it could be a possible cure for the virus. KSNT News reporter Kelly Peltier is live in Topeka now to tell us about this drug. Kelly?
Yeah, that's right, Molly. Hydroxychloroquine is commonly used to treat malaria, but the president and Congressman Roger Marshall both say they're taking the drug to help prevent the coronavirus. Today, I spoke with a pharmacist to learn more about that medicine. Mike Conlin is a pharmacist at Jayhawk Pharmacy in Topeka and says the drug has been around for years.
It's been used historically to treat malaria, prevention of malaria. It's also used in autoimmune diseases such as lupus or rheumatoid arthritis.
But now some people think it can help treat coronavirus. Conlin says there isn't any strong evidence that the drug prevents or treats COVID-19. He even talked about a recent study done by the VA medical system that is even suggesting the opposite.
The patients that had COVID, 27% of them died while taking hydroxychloroquine, where only 11% that were not taking it passed away.
Conlin says the drug is readily available and anyone can ask their doctor to prescribe it to them, but urges people to do their research first. We reached out to Congressman Roger Marshall for comment after saying he and his family are taking hydroxychloroquine. He says his family took the drug previously when they traveled internationally and wanted to take it again before he went into healthcare facilities with confirmed cases of the coronavirus. He says, as a physician, I'm able to weigh the benefits and risks, and in this case, the benefits far outweigh the risks. I have experienced no adverse issues while on the drug, but always stress to people that decisions on medication should be made with their doctor. Risks that Conlin says can include vision changes, heart failure, and depression. Conlin is encouraging people to be very cautious before taking the drug because it's not yet clear whether it will work at treating the coronavirus or not. Live in Southwest Topeka, Kelly Peltier, KSNT News.
All right, thank you, Kelly, for explaining that to us. Now, the pharmacist there also says that the drug wasn't being distributed as much at the beginning of the pandemic.